And when it's communicated in a way that allows that information to rely on an existing operational setting or workflow of the caregivers as well. So what we utilize are medical devices or other different various health products, and you'll get a sense of those that are available through the presentation, that are most important, look and feel and smell just like products that you would find readily available in stores, pharmacies, at retail. Devices that are familiar to individuals, like a blood pressure cuff you see here. All those devices are empowered with wireless technology. We actually use Bluetooth in our technologies. What we actually focused on and saw very early was that most people interact with the products, the medical devices themselves, and are typically unaware of the channels of communication or not interested in how the data is communicated. What we actually focused on was using smart, intelligent devices and allowing those devices to communicate across various different channels of information. And most often, individuals are stepping up on a scale in their bathroom, taking their blood pressure, pulling out their blood pressure cuff out of their night table stand in the morning or at night before they go to sleep. A lot of this information capture is happening in the home. But of course, we're looking for freedom of mobility because we have a large number of asthmatics, type 1 diabetics, individuals walking around with implantables that are walking around outside as well. So freedom of mobility was critical as well. So what you'll see here is the importance of flexibility and allowing individuals to maintain their existing routine behavior, allowing that information to be captured in the home, outside of the home, on the go, episodic or continuous. So we offer multiple channels of information flow through wireless gateways in the home, through Bluetooth-enabled cell phones on the go, community-based product offerings, which are kiosks, and we can talk a little bit about that as well. And allowing that information to automatically communicate remotely to individuals across the care continuum. Communicating information in real time automatically through the cloud and having individuals access information or communicate to them depending on their interaction. And as most individuals have been talking about earlier this morning in a panel and in this one, we still have a significant number of physicians using their faxes to capture information and not really utilizing health records. So we have to really serve realistically the population today and slowly transition and work with them, but allow them to take advantage of these communication technologies that are available. One of the other components, critical components of remote health monitoring is not only one-way communication of the raw data, but allowing us to close that feedback loop when we look at long-term sustainable chronic condition management. And what we do, individuals are engaged with their disease state or their condition when they're interacting with different products. They're stepping up on a scale, they're aware that they're monitoring their weight, they're thinking about their weight, taking their blood pressure, hopefully they remember to take their medication. Why not use that moment in time to further drive information flow, educate them and guide them towards self-management? So one of the things that we did was enable our products with messaging and not only deliver a tool to allow us to capture subjective information, make that raw data more meaningful, but also allow a platform, which is the most important, to allow us to guide individuals towards self-management and create those intelligent processes, those knowledge-based systems to really come back down to the individual health consumer. And again, our channels of communication, it's critical to be flexible. You're seeing now individuals not look at technology specifically, but applications and programs that can be utilized to manage hypertension, to manage diabetes, asthma, wellness programs, which is why we're excited to be here also, where we announced our entrance into the consumer space, leading with different wellness programs like innovative wireless pedometer that I'm wearing myself here as a fully integrated exercise weight management program, and utilizing different tools like the IdeaLife Health Tablet. And of course, you can walk around and see 1 million or 2 tablets here at CES this year. It's the year of the tablet. But again, looking at readily available technologies, using them in programs and applications. Here you will, we're announcing the IdeaLife Health Tablet, but more important is the program application in which you can utilize the health tablet. And what you will be able to do is access what will be the largest network of care specialists and coaches through the IdeaLife Health Tablet itself. And again, all these different technologies that allow us to create a new window of communication to health consumers, and offer those reporting tools that can now be automatically integrated to existing health record applications, or tools that can be available and free to users so that we can create that adoption. I'll touch on two last items, is really to think about these technologies as programs, real-time health monitoring products engaged with a cloud-based offering to easily integrate the data across various programs. And here you can have in a fitness program individuals engaged through their ID Life pedometer, receive notes and messages on their pedometer that my colleague or friend just beat me my record last night, lost an extra couple pounds. I can receive automated coupons or incentives through the ID Life pedometer, and on my cell phone application I can receive reminders of dining out options. Again, we've been really successful in Medicare senior population, and now we're starting to see usage a little bit below that around caregivers burden, remotely monitoring weight fluctuations. We've seen even readmission rates going down by as much as 60% with various segments of the population. But again, looking at usage today, practical life scenarios, some individuals can't step up on a scale. So we designed and developed the wireless chair scale. Through the messaging application and our innovative wireless pedometer, there are applications beyond just simple wellness programs that we're implementing in employer sites, interesting pediatric obesity programs, but just as importantly, our wounded soldiers coming back. This is Private Brock. He came back from Afghanistan after stepping up on a old Russian landmine. One of the most important things that is happening that the Army has been very successful at doing is managing the individual from the field back down to their home. But what happens when individuals leave the hospital? What happens when they leave the clinics? The same as what happens when we leave the gym? It's that continuity of care. And most important in situations like this is the mental health stability and encouragement that goes on, that constant engagement on an ongoing basis. So these programs are available today and being utilized. And I'll leave with this last piece with regards to China. We have a program today, and not just our company, of course I have to be biased with our own company, but programs are available today and have been proven already and are being implemented. This will be the largest implementation on the planet with regards to remote health monitoring, the first phase of which in China will be 100,000 people. But this just goes to show you that we're here today in a very exciting time. This inflection point with regards to remote health monitoring is because of the excitement with health and its intersection with technology. There are programs available today, and a lot of the people here, a lot of the things that you're seeing in the show will give you a glimpse of what's yet to come as well. So thank you. If you have any questions, please.
Jason, we're in this industry, we're in a sort of a paradoxical situation. We're dealing with high technology with often a population that is very low technology, interested and capable. What challenges does that present for you? Are there specific kinds of products that just can't get any traction? How do you have to approach an elderly market with making things easy to use and so on?
That's why form factor and use case scenarios are critical when evaluating the different types of products. And I think probably one of the most important experiences that we've had as a company over the last number of years is understanding that flexibility is critical. And not just from a technology perspective in health information exchange and interoperability, which is definitely no easy task working with so many companies. But most importantly, realistically, is with the end user, where in various programs, you might have a congestive heart failure program where family members are interested or worry about if mom or dad took the right medication to, again, maintain that water retention, ensuring that that doesn't happen with the weight fluctuations. Some people might simply step up on a scale, and that's it. Other individuals, as far as programs, because of the individual end user, might also request for them to take a home blood pressure reading. They might allow them to have a messaging tool like the ID Life Health tablet, where they can also engage them at a different level, reminding them about low-salt diets and components like that. So it's very important to be flexible in, that's why I always talk about remote health monitoring less as a technology, more about the application and program